Hi, this is Jeevaratnam and welcome to my channel Jeevan Astro Answers. And this topic is about fatty liver. Fatty liver is also known as hepatic steatosis. Fatty liver is a broad term that describes the buildup of fats in the liver, and it's also defined as an intrahepatic fat of at least 5% of the liver weight. As we know well that the liver is the second largest organ in the body. It helps process nutrients from food and drinks and filter harmful substances from the blood. When the liver does not process and break down fats as it normally should, too much fat will accumulate. Moreover, if the liver absorbs an increased amount of fat from the intestine, it may also lead to fat deposits in the liver. Principally, fatty liver is the accumulation of triglycerides and other fats in the liver cells. And these too much of fat in the liver can cause liver inflammation, which can damage the liver and create scarring. In severe cases, these scarring can lead to liver failure. Fatty liver is an acquired reversible disorder, and fatty liver is recognized as a significant component of the metabolic syndrome. Generally, fatty liver causing metabolic syndrome are characterized by diabetes or pre-diabetes, that is insulin resistance, and being overweight or obese, elevated blood lipids such as cholesterol and triglycerides, as well as high blood pressure. There are two main types of fatty liver disease, that is non-alcoholic and alcoholic fatty liver diseases. And fatty liver can also happen during pregnancy, although this is quite uncommon. Alcoholic fatty liver disease happens if you drink a lot of alcohol, that it may damages the liver. Excessive alcohol intake produces a fatty liver by stimulating lipolysis, as does starvation. Lipolysis is the metabolic process through which lipid triglycerides break down via hydrolysis into their constituent molecules glycerol and free fatty acids. And the free fatty acids accumulates in the liver, and therefore it leads to liver inflammation. If it's not treated properly, it can lead to liver failure. And Non-alcoholic fatty liver disease happens if you have excess fat in your liver and no history of heavy alcohol use, and it's considered to be as non-alcoholic fatty liver diseases. Eating excess calories causes fat to build up in the body as well as in the liver also. When the liver does not process and break down fats as it normally should, too much fat will deposit and cause liver inflammation. And one or more other factors may also play a role in developing fatty liver disease, and they are obesity, type 2 diabetes, insulin resistance, high levels of fat, especially triglycerides in the blood, metabolic syndrome, side effects of some types of medications, some types of infections such as hepatitis C, certain rare genetic conditions, polycystic ovary syndrome, obstructive sleep apnea, older age, underactive thyroid, that is hypothyroidism, underactive pituitary gland, that is hypopituitarism, may also play a role in developing fatty liver disorder. And acute fatty liver of pregnancy. Acute fatty liver of pregnancy is caused by when excess fat builds up in the liver during pregnancy. It's a rare but serious pregnancy complication. The exact cause is still unknown, although genetics may be a reason. Generally, fatty liver doesn't show much warning signs and so-called is silent disease. It's usually identified incidentally on ultrasonography or fibroscopy. When symptoms occur, they include fatigue, nausea, loss of appetite, weight loss, and abdominal pain, discomfort in the upper right abdomen, that is ascites, enlarged blood vessels just beneath the skin surface, enlarged spleen, red palms, yellowing of the skin and eyes, that is jaundice. In blood tests, fatty liver disease is usually diagnosed by the liver enzymes alanine aminotransferase and aspartate aminotransferase. If these liver enzymes are elevated, it shows a sign of liver inflammation. So, if your test results are positive for elevated liver enzymes, you have to go for additional tests to identify the cause of the inflammation. Fatty liver disease is one of the potential causes of liver inflammation, but it's not the only one. Some people with fatty liver disease develop complications, including liver scarring. Liver scarring is also known as liver fibrosis. If you develop severe liver fibrosis, it's known as cirrhosis, a potentially life-threatening condition that can cause liver failure. And the liver damage due to cirrhosis is permanent. That's why it's so important to prevent it from developing in the first place itself. Now we come to the medical astrology part, that is the role of planets, signs and houses for liver diseases. Cirrhosis is a disease caused by bile disturbance and the responsible planets are Sun and Mars. Seat of this disease is Leo and Virgo, 5th and 6th houses. Liver and pancreas are ruled by Jupiter. When above planets, houses and house lord are afflicted by malefics by their conjunction, aspects, etc., the bilirubin in the body increases. Leo sign is a seat of liver and Jupiter planet is a Karaka. Sun, Mars govern bile and Moon is the ruler of blood. If Leo, 5th house, 5th lord, Jupiter, Sun, Moon and Mars are afflicted, it gives liver troubles. In many cases, it's possible to reverse fatty liver disease through lifestyle changes such as limiting alcohol, adjusting diet, and managing weight. These changes may help prevent further liver damage and scarring from occurring. For alcoholic fatty liver disease in particular, it's important to abstain alcohol use entirely. If this condition left untreated, fatty liver disease can progress to inflammation, fibrosis, and cirrhosis. Scarring due to cirrhosis isn't reversible. If you develop cirrhosis, it also increases your risk of developing liver cancer and liver failure. And these complications can be life-threatening. Generally speaking, the outlook for fatty liver disease is best when treatment begins in the early stages before fibrosis and cirrhosis. And for the best outcome, it's important to follow your recommended treatment plan and practice an overall healthy lifestyle. I hope you might have received some useful information from this video. We will meet you soon in my next video. Till then, take care and bye.